The importance of a good PA-MD relationship. Why is it so awkward?
Where's my manners?
We're back with another episode of the PA Startup Podcast, and today we're talking about the importance of a good PA-MD relationship. You can't value enough, I think, having a good relationship with the docs that you work for. We're going to just touch on a few things.
Yep, that's what's going on. All right. This is intense.
I think I'm actually taller than you in real life.
I like
But
this.
I think my bucket is shorter than your bucket.
You're seeing the Home Depot bucket is what is it?
Or,
Tidy cats.
or it's not as sturdy.
I don't even have a cat.
My fat. Why do you have a teddy cat bucket?
This is really on the inside of PA Startup, but this is my car wash bucket. We are so high quality here. Okay.
One day, like and subscribe so we can get chairs.
If there's a chair company out there,
My wants to sponsor.
Okay. So anyways, there's a number of things that I think would mark a good PA-MD relationship. But for the new grads out there, what are the things that you should look for in your interview or in talking to other people that might know this practice? What are those things that you need to check off to ensure that you're entering into a good PA-MD relationship?
Yeah.
So what would you say is number one?
I think it's knowing making sure the MDs know what you bring to the table, like what your skill set is, what you've learned in school, kind of what the role of a PA is. I think sometimes for new starting doctors straight out of training, they don't quite know. They're not familiar maybe with PAs outside of a training facility.
Well, and in a lot of training facilities, they're so specialized. You have the ICU PA, you have the surgery PA, you have the clinic PA. It's so siloed that they might not realize, well, one of two things happens in my experience. One, they don't realize that you can go someplace else in the clinic or in the ER, whatever, or they're so used to having a ton of people around that they're like, why aren't you? I remember when I started, not when I started, but early on in my job, when we got a new surgeon that came in, he was asking, why aren't you escorting the patient to the OR? Like back where I trained, that's what everyone did. That's what all the PAs did. And I was like, escort him to the OR.
Yeah.
Like there's a nurse and there's an anesthesiologist. Like what do you need me for? I mean, I've got I could be pulling chest tubes. I could be writing notes. I could be doing a lot of other things, but that. And then after the case, he was like, why aren't you escorting him to the ICU? And I was like, again, we have a nurse and an anesthesiologist. I can go out and do other things. I shouldn't just look busy, you know?
Yeah.
So at training places, that whole segue was at training facilities, a lot of times there's, too many siloed things. So when a new grad doctor comes out, there's really not a lot of maybe a frame of reference for how we could be used.
And I think that how you go about, letting them know what you can do can be, it can be a delicate subject, especially for a new grad. But I think it's something you just feel out, like you said, when they said, why aren't you escorting the patient to think, well, typically the nurse does that. Like I was going to go see the consult and do this. Oh, okay. Yeah. Like that actually makes more sense. And it's, and you build some value for yourself the way you can have that conversation. If you have a head PA, sometimes it's maybe that's who you go talk to. Hey boss, like I feel like this new doc or this whatever is not recognizing what my role is or what I think my role should be.
Yeah. Yeah.
Which I think kind of is the second thing or another thing in terms of, the MD needs to know what your role is and what your value is, but you need to kind of know what your role is and what you bring to the table. It's not that there's a hierarchy. I mean, medicine is shifting away from that old school, right? Attending,
right.
down.
You're the doctor and I'm the assistant. Like, fortunately, we are getting away from that. It's not quite as old school as it used to be, but in some places it can be.
Yeah, but that team-based approach is where we're going. The PAs, NPs, MDs, PTs, all these people that have specific skill sets that they've trained so long for that they bring value. But knowing, okay, I'm still the PA, right?
Right.
I feel like sometimes, I remember when I was new, for example, you kind of come out jacked up,
gung-ho, ready to go.
just ready to go. And you're excited and it's great. And you think, not more than but you just want to,
you're excited to be there.
Yeah. You're excited to be there.
Yeah.
And I don't think that's the right thing to do. Or I don't
disagree with that.
Correct.
That treatment or
and
that.
I remember you and me sitting down when I was new and having some of those conversations. And I remember you specifically saying, at the end of the day, they're your boss. At the end of the day, they're the doctor. And it's like, okay, I think that is a gut check, self-awareness thing that takes a little bit of time, but it's important in that relationship that if you can go into the job knowing, you know what, I'm going to do my best. I'm going to, show them how valuable I am, but still humble enough to be like, but I'm still but I'm still the PA. Like I'm still the physician assistant. I'm not the physician. Sets you up to succeed sooner and sets up a better relationship where they don't think this kid thinks they know more than they do, or they don't know their role.
Yeah, when you as a new grad, if you come in, let's be real, you don't know everything right away. PA school is family practice oriented, so if you, regardless of how you did in school, you do not come out knowing everything. So if you get to your first day of work and you're like, I'm on equal playing field with everybody, you sometimes can come off as a know-it-all or somebody who doesn't know where their place is. And I don't mean that in a condescending way. I mean it in a, you just don't want to overstep your bounds right away. Eventually you can, but you just have to remember, like, okay, at the end of the day, I don't get to make the ultimate decision. If I say one thing and they say another, let's say it's pain meds, I'm going to give them this. And they're like, nope, I like to give this one. Okay. You can certainly explain why you want to do what you're doing, but at the end of the day, they get to make that call, and that's fine. It's totally fine. But have a spirited discussion about it is key. If it's, you're getting yelled at, that's not a good relationship. If I think of how to find these things out in an interview, the first point would be, how do you think a PA is best utilized?
Yeah.
And hear what they have to say. Just, well, I think they should do all the notes because I hate writing notes, and they should do all the discharges because I hate the med rec, and they should call all the families because I don't like talking to families. Like, whoa,
red flag,
huge red flags.
Right.
But if they're like, listen, your job is to extend my capabilities, so you might be seeing somebody in the ER while I'm seeing somebody upstairs, or I might be at this hospital and you're at that hospital. We're going to divide and conquer. That is a key a green flag. I've never actually heard that. It's not a red flag. It's a check
mark. Big check mark.
It's a check mark to say, okay, that is a good relationship.
Yeah. I remember specifically going into an interview, two different types of interviews. One where the MD there's a group of doctors completely just blew me off. Right. It was very much.
Oh, I didn't show up to the.
Like, if they did, it was for 2 seconds, and they talked to someone else in the room and were gone.
Yeah. I hate those.
And then a couple of the PAs would come in and chit chat with me. I was like, okay, there's a very clear dynamic in my mind here. At least that was the first impression, which is, I think, your first impression to them. You want to give them a good first impression, but you also are getting an impression was not really valued here.
Right.
And you did some digging, you found out turnover was a big issue, and you're like, okay, kind of adds up.
If you can't carve out time in your day to come to the interview, not good. Yeah. That's a bad
versus another interview where all the doctors took at least, I know we're all busy, but it took at least 5 minutes, 10 minutes to come up and just say, hey, thanks for coming. Nice to meet you. Where are you from? Where'd you go to school? Why do you want to do this? Do you have any experience? And I was like, okay, there's some value here in terms of you at least value the PAs here enough that you are spending some time getting to know someone that doesn't even work for you yet.
Right.
Those are some things I guess maybe you can look at. It is a crapshoot sometimes.
Yeah.
It really is. But things that you could be looking for.
And I think trust your instincts too. Like if it's like pulling teeth to talk to the doctor that's going to be your supervising physician, that's probably not good. You're going to be talking to him every day. Yeah. So if you can't have a laid back, casual conversation with this person when you're meeting them, Even if it's, hey, you know, what's on your schedule today, or
Yeah.
how'd your morning go? Like, if you just can't have those conversations, trust your instincts. That's maybe not a great fit.
Yeah.
Or if they didn't make time for you to come even meet you in the interview, that's a red flag too.
We've seen people in other practices that we work hand in hand and come in, wait over an hour for the doctor to come see them.
4 hours. It was 4 hours.
4 hours.
And I was like,
Yeah.
are you coming? And
The
they were
doctor
like, I
Not show up.
didn't show up.
Left. And then went
Yeah, that's right.
went to meet the other doctor who berated
Oh, yeah. Oh, that was
you
great.
in the operating room about not having found someone to come work for them yet. And then that person still took the job. And needless to say, it didn't end well. So
No.
don't be desperate.
Red flag.
You are a valuable team player in medicine.
Yeah.
You're a well-trained medical professional and know what you bring to the table.
Yeah,
I don't know.
I'm so sorry. I can't get this out of my head. It was total curveball. So this, bless this person's heart. They came in for an interview. We had everything planned. We had lunch brought in, and this person met other PAs and stuff. And we said, okay, we're going to have you meet the surgeons. And one surgeon didn't show up at all. And I kept texting this person and calling this person, and they said, yeah, sorry, I forgot. I'll be there in a little bit. And then an hour later, like, oh, I forgot again. Oh, nope, sorry, I already went home. And I was like, oh my goodness, you gotta be kidding me. And then we were covering, Garner was scrubbed in the operating room. And I go in and I'm like, hey, this is our candidate who's interviewing. And the surgeon lays into me about how he doesn't have help. He's scrubbed in. He's in the operating room helping at that moment. And he was like, this is ridiculous. This is crazy. And I was like, would you like to tell this candidate how great of a place this is to work?
And they still took the job. They're like, this is what I want.
This is it. I found it. This is what I want. Yeah, that was a bit rough.
I think another important thing that
I'm checking my notes. I'm not calling. I'm not texting. I'm TikToking.
Is I don't even know how to TikTok. But another thing to maybe pay attention to or ask questions about is the work-life balance, not just for you, but I think compared to the physicians that you work with.
Mm-hmm. Both are important.
Both. Yeah. Completely. I think my point is, I guess, that there should be a balance. There should be an understanding that you're going to, work when they're working. Yeah. Sometimes, like if it's a long day, for the most part, you need to be okay with, you know what, I'm going to chip in and help. But they also need to be okay with it. It's the knowing your kind of role. They're the doctor. Mm-hmm. At the end of the day, they're the ones responsible, and it's okay for you not to be there. Sometimes they don't need you attached to their hip.
Right.
What do they expect out of you, kind of in a time devotion type during a standard week? What can I kind of expect? If the answer is, if I'm here, you're here, that can get dicey sometimes.
Right.
If it's,
are they a workaholic and they're going to be there all the time?
If you're going into a specialty that you're going to be on call, okay, I understand I'm going to be here late sometimes, but what if you're here late seeing consults that I've already taken care of and things, well, I don't need you here. Like, you got your work done, go home. I think there's a discussion there that, or maybe while you're training and learning, okay, hey, am I good?
Right.
Can I go?
Yeah, and I think that's an important point to make too, is that during training, during a new job, any new job, there's going to be a period of time that you're working more than hopefully normal, because you're learning, you're listening to the spiel, you're going in with the doctor into the patient's room to hear how they talk about whatever the issue is. But what we're talking about is, once that curve is done and you kind of know what's going on, what's the role? What's the split? Because I would strongly warn against a practice that says, I need you to go see the consult, put in the orders, do the note, and then wait for me. And then when I talk to him, you're in the room with me. And then when we're done, you do anything else that needs done. Like, hold up. Like, if our best use of time is to divide and conquer in a practice setting, if it's to follow them from room to room or go into the room first and come out and give them a report, that's not really a good use of your time.
Yeah.
So those are,
I'm not your scribe. I'm not
right.
And I'm not your nurse. I'm not,
I'm not a personal assistant.
Correct.
We've seen that from time to time too. No, I'm not going to go get your dry cleaning. I mean, if you're friends with the doctor and stuff and you're like, hey, I'll go grab those cupcakes that you ordered because you're busy, like, okay, that's great. That's super nice. But if it's like, hey, on your way in, grab me a coffee at Starbucks, like,
pick up my dry cleaning on the way home.
Yeah.
I've never seen that actually happen, but
send my kids a birthday card.
Yeah. Our secretary has bought one of our doctor's presents.
Yes.
Or at least maybe wrapped them. I don't know.
Probably bought them, wrapped them with his credit card. So the key things to look for, I think, would be number one, how does the doctor view a PA best utilized? I would say that's top of the list.
I agree. Yep, for sure.
How do you view me as most valuable to the practice? And then listen to the answer.
Mm-hmm.
What was number two?
Knowing what you bring to the practice and kind of knowing your role as a PA versus an MD, knowing the differences and what to expect.
Yeah, right. So knowing, okay, my role is the PA and I'm going to come in and provide excellent medical care, but at the end of the day, I don't need to feel guilty about leaving when my work is done, because we don't have a lot of committee meetings. We don't have a lot of politics that we have to play with other providers and things. So it's okay. It's okay to not work the same number of hours as the physician because they get paid more.
Yeah.
And they went to school for longer, and I understand that. But when it shifts to you're doing the grunt work, you're doing the stuff of their job that they don't want to do, that's a problem.
Yep.
That's a red flag.
All of these topics are all of these points we're making, I think, are different but similar, right? It all kind of intermingles, right?
Right.
We're different roles, but knowing the roles of each person, respecting the roles of each person, respecting the time of each person.
Right.
All those things go together. And if you can kind of hammer those things out, or at least get a good understanding of what the expectation is before you start or in those first few months, I think it's going to make your relationship with your doctor that much better.
Right.
Or make you realize this relationship is not going to get better, and the good thing is you can go do something else.
Yeah, right.
So
another often overlooked feature of a good relationship is somebody who has like a structured onboarding or training program. Wouldn't you say? Like,
for sure,
regardless of if it's a specialty, a surgical, non-surgical, whatever job.
We've seen multiple people, not when I say fail, the PA's not failing, but not thrive and end up leaving because they have no structured training. They show up and it's just assumed that they're going to know a lot of stuff that is on the job training. I mean, no matter what we learn in school, no matter what specialty, family practice, whatever you end up doing, there is an on the job training that takes place.
Right.
And not having a structured training from your doctor sets you up, I think, one, to look stupid,
right?
Which doesn't help, right? It sets you up to, the expectation has to be like that you're going to need some teaching.
Right. So the difference would be show up on day one and just try to keep up versus, okay, this first month, here's what I want you to focus on. These are the things I want you to see. These are the patients I want you to see. This is what I want you to perfect. And then after that, we're going to go on from there. And
I think you mentioned to me one time your first job or one of your first jobs, talking about the response you'd get from your doctor was, that's a 3-month thing.
Oh, yeah. That was a great...
I expect you, I don't expect you to know this today. Mm-hmm. I expect you to know this at 3 months.
Yeah.
Okay, that's a 6-month thing. Like, it's more complex.
Right.
Like, I'm going to teach you at 6 months, you should be doing this on your own.
Yeah.
Okay, now it's clear cut. All right, these are the expectations. This is what my role is.
Right.
Versus, I can't believe you didn't know that.
Yeah.
I can't believe you didn't do that. Why haven't you done this yet? Why haven't you done the note?
I've never heard that ever.
Just
kidding. I totally have heard that.
Why isn't the discharge summary done? I never did one, or I only did one.
I don't even know what one looks like. Yeah.
Like those are things that I I think is a good question to ask in your interview is, hey, what does training look like?
Yeah, what does training look like? That's a great point. In my first job was general surgery, and Dr. Cole, he was actually the first person that downloaded the podcast. The very first download I ever
Really?
got was him. Haven't talked to him for years, and he sent me a thing on LinkedIn, and he was like, hey, man, just listen to your podcast. Great work. And I was like, oh. So he might be watching right now. So Dr. Cole, thank you so much. You were a great teacher, a great mentor. So he would say, that's a 3-month thing. That's a 6-month thing. If I missed a hernia or something like that, he would say, you know what, that's a 6-month thing, which told me 2 things. One was it was a difficult skill to learn. It was going to take some time. So that kind of took me, I was off the hook for a little bit. I mean, I needed to learn it, but he wasn't mad that I didn't know it. But then the second thing was I needed to know it, especially by 6 months. So if there was something that was a 3-month thing, that was something I needed to learn a little faster, or maybe it was a simpler concept. But so that was all good. But if you have someone that doesn't have any sort of,
We'll just figure it out.
We'll figure it out.
I'll figure it out.
Yeah, you'll catch on. Well, hold on. What do I need? Like, what's most important for me to learn? Like, if you're in a family practice office, don't start with like the super sick diabetic patient that needs like crazy diabetic management.
Yeah.
Start with a simple new patient intake.
Yeah.
H&P.
Sports physicals.
Sports physicals.
Things that we know, but it just so you get a comfort level.
Right.
And
right. You shouldn't be doing the big stuff. But whoever's training you needs to say, okay, so the first month we're gonna work on colds and ear infections and sinus infections. Okay, so anyone that has those symptoms, they're coming to you. Great.
And at a year, I want you to be seeing your own patients.
Yeah.
If I can't see them and they need to get in, I want you to be able to take care of most stuff.
I want you to have your own clinic, your own schedule. You book your days on, you book your days off. Like, that's incredible because then you have a goal to work towards. I think that's important. Good. Let's see. The other thing, I don't know how this applies, I guess, this isn't necessarily a sign of a good PA-MD relationship, but at least it demonstrates the MD's understanding of what we can do, our value, is to ask, what other opportunities could there be in the future for me? Either within the practice. Is it a leadership role, like a head PA position or something like that? Do they provide a representative to the hospital medical staff? What other opportunities are there? And if they're like, I don't know, you just see patients, like that seems pretty impersonal. Like they don't really know what a PA could do. But if someone's like, oh, you're a valued member of the medical team, and here's other things that our PAs in the past have done. Yeah, they are at least paying attention.
They've
which is
done
a good thing.
Education for the nursing staff. They've done outreach clinics or things like that that help grow the practice. Or, we totally could see you starting your own type of special clinic or something like that.
Right.
Would be more of what you're looking for, I think, in that type of question, right?
Right.
Versus, you're going to come in and you're going to do your job.
Yeah, you're going to come in, you're going to do some notes, and you're going to take the people I don't want to see.
Yeah, exactly. It's the value thing again, right? Like, what is my value to you, right?
Right.
Obviously there's a financial value, there's a number associated with it, but
what can you generate for the practice?
Correct. But just overall, what is the expectation long term, I think.
Right. There's a difference between a practice. We have to understand that there's definitely a financial component to this. If you're losing money for the practice because you're not generating enough revenue or you're not efficient, that's a problem. But a lot of places will look at the PA and maybe say, you know what, the physician might see patients every 15 minutes, but we want the PA to see patients every 20 minutes. And maybe that is because you have a little bit more time to sit back and talk to patients. I hear that all the time that, I come in, I sit down, hey, how you doing? Hey, like your jacket, where'd you get that? It's more of establishing a relationship. And if you have a practice that is, hey, we really want you to nurture our patients or take care of our patients, like that's great because they have a role for you, they have a goal for you. If it's like, hey, if I'm seeing people every 15 minutes, you need to keep up, and if you can't, then you don't belong here. It makes me a little bit nervous.
Yeah. I think one last thing maybe to feel out in your interview or when you're starting is personality differences.
Right. Yeah. It's good.
Some people just aren't going to get along, right? There's type A's, and I think most PAs, in at least my class, I thought I was type A until I found out there's a lot of people that are way more type A, but there's
certain people. I can't imagine who that would be.
There is, I think, just in general, people that click and people that don't.
Yeah.
And we're lucky enough to work in a practice where there's multiple physicians of multiple types of personalities, so you kind of get a mix. But especially if you're in a practice where it's you and one doctor, or you and two doctors, and your personality doesn't click with them, and you get a vibe in the interview like, man, I don't know, I just don't know if this is. I like to crack jokes, and you clearly do not. Like, that might be a sign.
I feel like Garner's heard that before.
I had a family practice attending that was German, and stoic as could be, did not laugh at a single joke in 6 weeks. And I was like, and that is someone that would not be a good fit for me. So I think it's just something to be aware of. Like, what kind of personality are you? What kind of personality do you kind of think they are? And is it going to be a good fit, or is it going to be awkward all the time?
Yeah.
So
here's a question for you. What if you have to stay in your city and there's only one job available, and you've picked up on a couple of things that we've talked about? What do you do?
Man, that's a good question. I think there's something to say for experience to some extent. I don't want people to ever undervalue themselves at all. I think obviously right now with COVID and job markets being strange and things, we hear a lot of students that say, there's nothing out there, but I need to start paying, student loans, or I have a mortgage. My wife's working 2 jobs. My husband's working 2 jobs while I'm at school. I don't know. I think everyone's a little different, but I think you can do anything temporarily, but I think it's vitally important to know these things we're talking about and know, okay, I'm going to give it a good shot here. But at the end of the day, if this relationship isn't great, then it's okay to work hard, put some time in. When things change, exit on a good note. So
I agree. I think your comment about there's a lot to be said for experience. If you take a job that maybe you're not crazy about, but you dive into it and you try to digest as much of it as you can, I think there's a lot to be said for that. If you see some of these things that we've talked about, and maybe that's the only job and you have to take it, write down before you start what your goals are. Yeah. And I would encourage you to not get caught up, because what's going to happen is you're going to be 6 weeks in and you're going to be at odds with the physician for some reason because of the red flags that we've talked about. And you're going to get so consumed by it that your self-worth can actually be damaged a little bit. And you feel like, well, maybe it's me. I mean, it must be me, especially if they're telling you things like that, but if you've written down at the beginning, I'm taking this job because I want to gain some experience. I know it's not ideal, and I'm going to keep looking, or I'm going to wait for a better opportunity or something like that. Go back to that and just refocus, because sometimes, especially like Garner said, in a time like this, we're not really sure what jobs are open and where to go. So you might have to take a job that you're less than thrilled about. Yeah. But remember why you're taking it. It's good experience, and it's good to learn how to work with difficult personalities. But at the end of the day, if your self-worth is being hurt because of this, then you need to jump ship.
Yeah, 100%. I think you can do your best to use some of these things we've talked about to change, your relationship, improve things,
positively
educate a new physician, a little bit without being a jerk about it. But like Dar said, in the back of your mind, no, I'm doing this for a reason. And at the end of the day, if it's not a good fit, I think that it's the most important thing. Your relationship with that doctor, if it's miserable, it's just not worth it.
It's a rough day at work.
It's a rough day at work.
All right. One last thing is, what was the quote that you were told at your interview about work-life balance.
Yeah. And I took the job.
And you took the job.
That was one of many comments that I guess it was. But I will do anything in my power to make your life better, as long as it does not negatively influence mine or negatively impact mine. And I said, that is the man. Sign me up.
Yeah, I want some of that.
No red flags. No.
I'll do anything to make your quality of life better, as long as it doesn't negatively impact mine.
Yep. But it was funny because I think I turned around and I called him on it right away. Didn't even know him because it's just funny. I joked about it and immediately became a joke. Like it was an instantaneous. He laughed. I was like, okay, you and I are going to be able to get along.
This is going to be all right. Yeah, and you do. Hey, if you're new here, don't forget to hit subscribe. Hit the notification bell too. We'd love to hear from you. Leave a comment below. What do you think about this? What are other red flags that you've seen in good MDPA relationships? What are other things that you look for in a good MDPA relationship? Also, head over to our website, pastartup.co. We've got some great free resources for new grads out there, resumes, cover letters, stuff like that. And you can catch all of our old episodes on there too. So, anything else?
If you guys got anything you want us to touch on, any ideas, any questions, hit us up. We're always looking for some new topics to
What questions
research
are you
and discuss.
What are you dealing with? What kind of things are you struggling with, or what are you just dying to know the answer for? If we don't know it, we'll either find out or we'll make it up.
See you guys.
See ya.